we ready on the back table?
At King's College Hospital in London, Dr. Nigel Heaton performs a liver transplant surgery with a live donor. A young man is giving part of his liver to his younger brother.
So that's the piece of liver we're just taking out here. We're just going to flush it now.
The liver is cut in half, with one part for the younger brother and the other part staying in the donor.
The liver is a remarkable organ in that it's made up of 8 segments, so you can take pieces of the liver and it'll function perfectly well.
This transplant costs tens of thousands of dollars. But under Britain's National Health Service, or NHS, the patient doesn't pay a thing.
When patients come to us, we only evaluate them from the point of view of their need. Do they need a liver transplant? The cost never comes into it. As a surgeon, I love that because it means the focus is on the care that I can deliver.
Nobody pays a doctor's bill on the NHS. People will go their entire life without paying a single upfront cost. Hello, smart.
Dr. Claire Gerarda is the chair of Britain's Royal College of General Practitioners.
Our health service is fair. It means that irrespective of what you can afford, irrespective of your illness, you will be able to access healthcare.
137,000 people died over 7 years because they were uninsured. Of course, the Brits do pay for their healthcare in another way, with taxes. The sales tax is a whopping 20%, and income taxes are as high as 50%. All of that money feeds a healthcare behemoth. The NHS is Europe's largest employer, with well over 1 million people on the payroll. So you'd think it would be inefficient.
That seems sensible, right? The private sector can do things more efficiently. It doesn't work in healthcare.
T.R. Reid, a former overseas bureau chief with the Washington Post, toured the world's healthcare systems for his recent book, The Healing of America.
The least efficient payers in the world are the American private insurance companies. They have administrative costs of 20 to 30%. That's a 30% tax on every dollar you spend on healthcare. Britain is totally socialized medicine, administrative costs 5%. Canada is private doctors and public payers, 6% administrative costs. So it turns out in healthcare, governments are doing this more efficiently than our private sector.